Just a few ground rules. Feel free to interrupt me as we go along if you have questions, because I do know that when I have a question at the moment you're talking, somebody's presenting information to me, by the end I forget. So please feel free to interrupt me, say I have a question or whatever, very informal. Don't really like speaking from a podium, but that's okay. I can deal with that today.
Just walk around.
I probably will end up walking around. I'm gonna wait for my coworker to help me with. She's gonna help me with. Sean's gonna help me with the slides today. So, the first thing I wanted to do was talk about myths. So the first myth is advanced care planning is only necessary when you're ill, at the end of life, or very old. That is a myth. We start conversations, advanced care planning conversations, at the age of 18, because that's when people are adults. And if we think about pediatricians, you have a beautiful preschool over here. When they go to when those little toddlers go to the doctor asks, the pediatrician asks, well, how old are you? What's your favorite color? What's your teacher's name? Are you good? Mm-hmm. Oh, okay. I saw you doing this. That's getting to know your patient. They're doing it to, of course, understand or figure out developmentally where that little toddler is. But those types of questions are the same questions that adults should get from their primary care provider. Think about it. Tell me what you do for a living. Are you married? Do you have kids? Are there other things going on in your life? Do you have any concerns or worries about your health care? All that's part of advanced care planning. So our doctors, we have found out, are doing this, but they're not calling it that. And so we want to make sure that everyone understands that those questions are, yeah, we want to get to know you well, but they're also part of advanced care planning. So what is advanced care planning? It's a repeatable process. I say it's repeatable because at 18, I would make different decisions than I would have made when I was 20, 30, 40, and 50. So we have experiences as we age, whether it's our own family experiences by others, our friends, co-workers, and sometimes those experiences kind of change your mind about some of the things that you may want as far as healthcare and healthcare decisions. But it does include advanced directives, which are your healthcare power of attorney and living will. Each of you have those documents on your table. It also includes medical orders, which are that doctors have to sign. You might have heard them called DNR or MOST forms. However, the conversations are in the middle, and those are the most important things that you can have. There are people that will never complete an advanced directive, ever. My mother was one of them, but she told everybody that she wanted to be a DNR. And we knew that she did not want CPR. She had some very chronic health conditions, and so when the time came, when we were at the last hospital, that she was not going to survive that hospitalization, we knew what she wanted. She wanted to be left alone. She just wanted to go to sleep and not have to worry about anything else. She didn't want to be poked, pricked, prodded. So that's what we did. So what we find out, a couple of statistics. 80% of people would like to talk to their doctors about their medical treatment and their wishes if they should become seriously ill or be at the end of life. However, only 7% of our people actually have those conversations. So we know about COVID. COVID is a prime example because everybody had an opinion about COVID, whether it was real or not. They had an opinion about the treatments because they were so new, whether it was good for them, bad for them. We have people talking, had opinions about the vaccine, and if they were actually putting some sort of a tracker device in that vaccine to track every single American or person who took it. And that's okay. It's okay to have an opinion because that's yours and you own that, and that's fine. And in healthcare, we don't judge those opinions. We just want to do and take care of you the way you wish to be cared for. And last statistic, 65 to 76% of physicians whose patients had an advance directive, a healthcare power of attorney, or a living will, were not aware of it. So that means conversations aren't happening. People do want to have these conversations. People are completing their advance directives because of maybe they had a whole estate plan and everything was included as well as your advance directives. But they're not telling anybody it's there. They're not giving the hospital systems a copy of it so we can upload it in your charts. And honestly, if it's not there, it doesn't exist to us. So if you do have a healthcare power of attorney or a living will, please make sure you get a copy of it to your provider so they can have it uploaded in your chart. Because in an emergency, if it's not there, it doesn't exist. And obviously our main concern is making sure that you get the care that you want. And we know how to care for you. Oh, someone asked me a statistic. Where's you, sir? He asked me earlier to get Google out. He asked me, how many Americans actually have an advance directive? Well, number one, I did consult Google. Google does not, well, let's put it this way. There is not a national registry for advance directives. But in one study in 2017 by the National Institute of Health, National Institute of Medicine, among 800,000 people, 36% had a healthcare power of attorney and 29% had a living will. Okay, so a little interaction here, here. Would you rather? You can either shout it out, you can either talk amongst yourselves, or let's see what would you rather. Would you rather be treated the way you want by making sure your healthcare decision maker knows what you want, or let your next of kin decide what's best for you?
One.
The first one. Yep. There are some people who have said to us, oh, well, my family knows what to do. Not that they had a conversation, but my family knows what to do. Would you rather be free from pain, or would you rather be mentally aware?
Mentally aware.
That is hard. That is a hard one. Because there's so much in between pain and mentally aware. We've had patients who've said, listen, I don't want to be in pain, but when my family is here, I want to be awake, aware. I want to be able to interact with them. So they have scheduled when their family's coming in, and they have scheduled when they're going to have pain medication and when it will kind of start wearing off. And after their family leaves, they schedule their pain medication again. So those are the types of conversations that you should think about having with your decision maker. So would you rather not be connected to machines or do everything possible to prolong my life? Not to be connected to machines? Again, there's so much in between, right? Some people say, I would like a trial. Go ahead. I want to make if there's a chance, let's try it. But if comes to a time when there's no hope and I'm not going to recover, go ahead and disconnect me from those things.
How do you determine that?
Well, that's where conversations really come into play. Conversations not only with your decision makers, but also with your doctors. And your decision makers having access to your doctors to have those conversations as well. And, doing everything do everything is also kind of a loaded question. Because do everything and you not be able to ever go back home? Would you be okay with being in a nursing home or a long-term care place for the rest of your life because you wanted everything done? There are some people who'll say, oh, no, I don't want to go into a nursing home. I don't want to do that. But other people are, hey, as long as I'm this side of, I'm on top of ground, I'm good. And that's okay. Whatever you decide to do for yourself is okay. And we just want to honor whatever it is that you would like. Next slide. So conversations are important because, again, people need to know what you want. People want to know that they have some control over their lives and some of the decisions that they make. If you don't have some of these conversations, decisions are often made by a person in the emergency department, a doctor in the emergency department, or an ICU. If you haven't had these conversations with the people who can make decisions for you. And you know, those doctors don't know you very well because they're just probably seeing you for the first time. Doctors will come in, if you aren't able to speak for yourself, doctors will come into the waiting room and ask you, give your family 2 or 3 options. Again, you don't want them to guess, you want them to know what your answer would be. You also may get excessive and unwanted treatment, which also correlates to excessive and unwanted medical bills. Because there are some people who are very conscientious of, I want to be able to leave something for my family. I don't want them to have to spend their inheritance or whatever on medical bills. There are some people who are very, very concerned about that. And there are some who say, they don't need an inheritance, that's all my money. Go ahead and spend it. And it's okay. Again, whatever you decide is okay. We just want to make sure that you have had conversations with the people important to you. And also there's research about complicated grief, major depression, anxiety, and guilt. When those conversations haven't occurred and your person who's making decisions never had a conversation because people just don't want to talk about it. Grief, depression, guilt, anxiety. And sometimes even when you do have those conversations, there may be something that comes up that y'all didn't really talk about. So, you know, some of those feelings might happen anyway, but the more conversations you have about different types of scenarios, the better. You know, I always tell people, start with your family history, health history. What are some of the conditions that run in your family? Talk about how that person's experience was. Now, medical technology interventions, they improve, they change all the time. So again, you know, having those conversations, seeing what is the latest and greatest treatment for X, Y, and Z. Any questions? Yes, sir.
If you, let's say that you and your spouse are out of state somewhere, and an accident happens, maybe one person is put on a ventilator and the other one is just hospitalized but can't speak.
Mm-hmm.
When do they decide, how do they decide, how do they even know to look for that power of attorney or living will? I mean, if your doctor back home in North Carolina has it, then how does that ever, it might not work, right?
Right.
Okay.
A lot of people now with smartphones, they have a 911 emergency contact or an emergency contact that it would unlock for people to see it. We do have wallet cards that we ask people to put who is their next, who should be called if you have, or where your advance directive is. So there are ways to do that, but you're right. I mean, it's very difficult. One of the things that we do have now is, you know, all hospitals have to have an electronic medical record.
Okay.
And those hospitals can share some information. Like if we have a system at Novant and at Atrium called Care Everywhere. We can see some things in Atrium's chart on you. Out of state, I'm not so sure how that works, but yeah. So technology's catching up.
I'm afraid somebody might hack into my account.
We're always,
Right.
I'm afraid someone's gonna hack into all my little accounts. And
Yeah.
I'm like, whether it's healthcare, banking, investments, I mean, everything is online. It's all digital now. It is kind of scary. So, I think I probably even already answered this. My loved one knows what, my loved ones will know what I want when the time comes. I've probably already told you, they may not know. And it really is, it kind of depends on if you've had conversations. But one study from the National Institute of Health said, did a study, and 1 out of 3 people guessed right. So I guess they have a third of a chance of guessing right. All right, next slide. So North Carolina has a healthcare decision-making law that everyone in the state of North Carolina has to follow, especially healthcare systems, right? So, as long as you have capacity to make your decisions, you decide what happens to you, unless you want to delegate that to someone else. Even though you have capacity, we've had some people do that in the past. But as long as you have capacity, we're talking to you. If you don't have capacity, then we're going to look for that legal document, healthcare power of attorney. So, as you see, healthcare power of attorney is 2A. So that's the first document that we will look for. That's the one document that people, every time you go into a healthcare setting, ask, do you have an advance directive? That's actually a law that all healthcare providers, we have to ask it. So even though we keep asking and you've either told them yes or no, we'll keep asking. So thank you for your patience. That is a Medicare, Medicaid guideline that we have to follow. The other 2 documents we do not really, we don't assist with. We can assist you with a healthcare power of attorney. You don't have to go to an attorney to complete that. Your hospital system has ways to help you complete that. And we can actually help you complete that today if you don't have a healthcare power of attorney. So if you don't have any legal documents, then it's your family. So your family is a legal spouse. If you are legally separated, you are still legally married according to North Carolina. North Carolina does not recognize common law marriage. So you have to be legally married. Then if we have no legal spouse, then it would be your parents and all of your adult children. So if your 2 parents are still living and you have 3 adult children, all 5 of them have to come together and make a decision if you do not have a healthcare power of attorney. Then, if we can't find parents or adult children, then it would be all of your adult siblings coming together to make a decision. Number 1, majority rules. So, if you have 5 people and 3 people want one thing, 2 people want another, the 3 people have majority. Family conflict is one of the things that comes to mind. And I forgot to, majority of those who are reasonably available. What does that mean? So if your parents are still here, you have 2 parents and you have 3 adult children, one of your parents may have a dementia and can't make decisions for themselves, let alone someone else. That parent is not available. If you have an adult child that is serving our country overseas in our military, they are not reasonably available because they are doing the work of the United States. And we can't just call them up on the phone and say, hey, can you participate in this conversation at a moment's notice? I'm sure it can be arranged at a scheduled day and time, but they're not reasonably available. So that means then you'd have 3 people actually making decisions. So, any questions so far? Anything that surprises you? No? Okay. So friends, let's get to the category of friends. So since your spouse, parents, children, and siblings are the only family that you have, where does everybody else go? Where do your aunts, uncles, cousins, grandparents, where do they go? They're friends. in North Carolina. We have people that are raised by a grandparent these days, but don't have custody, or may have had custody, but they didn't go through an adoption. So those are friends. Step families, if you have a stepmother, step brothers, sisters, they are considered friends in North Carolina, unless there has been some sort of a legal adoption somewhere. Friends also include the person that may not believe in marriage, but have been living with someone for 20 or 30 years. That's considered a friend. As well as your friend from high school, friend from college, friends from church. Those are also friends. But they have to be an established relationship, someone who knows you well and would know what kind of preferences you would have. So what happens when, well, I'll speak for myself. In families, my families, there are people I trust with some things and not others. So I'm gonna pick who I trust, and I'm gonna name that person in a healthcare power of attorney. Because if I name that person in a healthcare power of attorney, they don't have to go to 3, 4, or 5, right? So as long as I name that person in that healthcare power of attorney, we don't have to look at it. We don't have to go any further. So that's the importance of completing that healthcare power of attorney, because we want to know who you trust. Our fans say, who do you trust? Who do you trust to make those healthcare decisions for you if you could not make them yourself? So if you don't have a healthcare power of attorney, in this conversation, just with this slide alone, you might encourage you a little bit more to think about it and maybe actually complete one. So if we don't have any friends, then we have physicians, the doctor in the hospital that's taking care of you. The person, a doctor who doesn't know you well at all, if we can't find anyone. And I do know from Novant's standpoint and Atrium that we err on the side of life. So we do everything to preserve life until it's apparent that it cannot be. So understand, we will always try to preserve life. Any questions, comments? Yes?
So if you have a primary care physician listed, will they try and consult that person as the physician before just, you're in the ER and that doctor's making the decision?
Probably depends on what's going on. Again, we have an electronic medical record. Our doctors in the hospital can see the notes from their doctor's office. So it probably just it probably really just depends on what's going on. But I can't guarantee or say for sure that the primary care doctor would be consulted or contacted.
Is there, you said there's some kind of card you should have in your wallet or something like that that says, by contact, this is what I want done?
Yeah, I have them on the table.
Oh.
I forgot to get
That's
them
all
to
right.
y'all's
Okay.
table, but I have those.
Okay.
All right, next slide. Myth 3, my healthcare agent will be able to make decisions about my care as soon as I complete the healthcare power of attorney document. That is a myth. The only time the healthcare power of attorney document comes into play is when you do not have the capacity to make decisions for yourself. This also includes when you're under anesthesia for a procedure, colonoscopies. I've had one. I'm under
Lucky you.
anesthesia. I know, right? I've had one. Turned 50, happy birthday. The age now is 45 though, right? For people
I
at
think
higher
so.
risk.
Wow.
Yeah. So, they tell me that, you're not supposed to make decisions for about 24 to 48 hours after being under anesthesia. So, I need to have someone available to make decisions for me. We've got kids that get their wisdom teeth out, gallbladders, appendectomies. And then you have more serious surgeries, obviously. But the minor things probably happen in our lives more often than not, because those are preventative type of procedures and things. So let's get to the document. So the first thing is your healthcare power of attorney. You have this document on your table. It starts on page 3. And this is where you would name at least 2 people to make decisions for you when you cannot make them for yourself. Just put in as much information as you would like, or at least a phone number and their name. So that's what that space is for. Next slide. The special instructions is number 2 on part A. The special instructions are for you to tell us anything that we need to know about you, or it helps to guide your healthcare agent, the people that you named up top. We've had people put, I want to be cremated. We've had people who've said, I've already made arrangements for body donation. Call this number when I die. Some people have just put, try everything. We've had some people who put, don't do anything. But if there is something special about your culture or faith that you believe strongly in that we need to honor, put it there. Organ donation. So the last decision you have to make on your healthcare power of attorney is whether or not you want to be an organ donor. We do know that people have little hearts on their driver's license, and that heart actually means that that person is in the North Carolina Organ Donation Registry. So if you strongly believe that you want to be an organ donor, we would highly recommend you initial box 3. How many of you have teenagers in your life in some way, shape, or form? Okay. Well, you know at the DMV, when they ask this question, they're asking it to your teenager, 16, 17-year-old. They do not ask the parent, they ask the child. If you have a young person in your life that's driving, whether they're in their teens or early 20s or even late in their 20s, ask them if they're an organ donor. Because we've had many people, or unfortunately some accidents have occurred where a young person gets in an accident, a really bad, terrible accident, not going to survive. They're on they're in the North Carolina Registry for organ donation. Their family had no idea, and they did not believe in organ donation. That becomes an issue in a hospital. It becomes an issue for the family, and it becomes an issue for the people who are sent by the state to get those organs. And sometimes they don't get the organs that person wanted somebody else to have. Yes, sir.
Is there an age level for organ donation where if you're a certain age you can't do it anymore?
I haven't heard about an age limitation, but it probably depends on how healthy you are at that age. Because if you don't have any heart problems, no cholesterol, no, heart, and also even just tissues. I mean, it doesn't have to be an organ. It could also mean tissues. It could be eyes. It could be skin. So if I complete an advance directive and something happens to me, they will not try to save me. This is another myth. An advance directive gives us guidance for future health care, not the here and now. So if you complete an advance directive and you get in a car accident and you come to our hospital, we can see you have an advance directive, but it doesn't matter because we're gonna try to save your life. We're gonna try to make you whole again. So even if you don't have capacity for a few days, we're gonna do what we can to make you whole again, to hopefully get your capacity restored and you back to the way you were. There are gonna be some times when that doesn't happen. And maybe you've suffered a really bad head injury and they don't believe you're gonna ever wake up. Then that's when that advance directive may come into play. But that's why you also have decision makers that you listed, right? to help with that decision. So part B of the advance directive is the living will. At the top, if you do not want to prepare a living will, just initial and strike through the whole page. But if you do, the state highlights 3 conditions in which you can say or tell your healthcare providers that you do not want life-sustaining measures. First, if you have a condition that can't be cured and that will result in your death within a relatively short period of time. You can initial that or leave it blank. The second one is if you become unconscious and your doctors determine that to a high degree of medical certainty you will never regain consciousness. Initial that one or not. And then the third condition is if you suffer from advanced dementia or any other condition which results in a substantial loss of my ability to think, and my doctors determine that to a high degree of medical certainty, this is not going to get better. And right now, there's really no cure for dementia. It's a progressive disease. They can slow it down. Lots of new medications are coming, I'm looking at the commercials in my head, but there's still no cure right now for dementia. So you can select all 3 of those, 1 of those, 2 of those, whatever you feel strongly about. My advance directive, my living will, dementia runs in my family. Both my parents had dementia, mixed dementias at that. So I have initialed that block myself, even though I hope to never have it. So, any questions about these 3 conditions? Okay. All right. Number 2 is even though you do not want life-prolonging measures in the above situations, that you still want to receive nutrition, and usually tube feedings is what it's called. So there are some people who feel strongly about always nourishing, always providing the body what it needs, some sort of nourishment. There are other people who say, why would I need it? So it's really just a personal preference. As a matter of fact, we had a gentleman in one of our hospitals, I can't remember what the religion was, but their faith leader told the family that if you remove their parents' feeding tube, it would be considered murder in their faith. So no matter what the recommendations were, no matter if he got an infection in that tube, it didn't matter, he would die from the infection, but it wouldn't be because we starved him to death and murdered him, according to their faith tradition. Number 3, we're always gonna make sure that you're comfortable and clean. Number 4, that your healthcare providers can rely on this document to make decisions for you, to withhold or discontinue sustaining measures. And the last decision you would have to make is whether you can only initial one of these, is that we are going to follow the living will as you outlined, or you're gonna allow your healthcare agents, the people that you named in your healthcare power of attorney, to make some decisions that might be different. Because depending on when you complete your document, things could have changed, right? COVID is a great example. So during COVID, people had advanced directives. They were put on ventilators. They were put on all these life-sustaining treatments and measures to try to restore them. If we had just followed that living will, those people wouldn't be here. So the healthcare, so if 15, 20 years down the road, even though my decisions are still the same, something could happen. Another novel virus like corona could come up, and your healthcare agent may want to make sure that certain things are done. But it is your choice. There are some people who say no, just they're gonna initial that top line and that's it. And others, again, it's a personal preference. And whatever you decide, it's okay, it's your choice. So, you must go to an attorney's office to complete my advance directive. That is a myth. I think I already probably answered this at the beginning. We can help you complete an advance directive today. All you need are 2 witnesses and a notary. The 3 of us are notaries.
Oh, no.
So, and I see witnesses everywhere in this room, as long as you're not related to each other. We can get your advance directive completed today.
Angela,
Yes,
also, if they want to take this home,
yes.
we have May 2nd reserved at the same time here in the Fellowship Hall for these 3 ladies to come back, and they can notarize your living will advance directive
Okay.
then.
Right.
If you don't want to do it today, May 2nd is reserved.
Yes, and I do encourage folks, there are some people that we find that have been thinking about this for a long time and are ready to jump on this today. But we do encourage you to go home, talk to the people you're gonna name in your document. Make sure that they're okay with it. Because we've had situations in where we've had phone calls from people who say, you know, I've had this discussion with my daughter, she's my only next of kin, and she says she's not gonna follow my wishes, because she's just not gonna do what I've asked her to do. I said, well, you need to go back and find somebody else. Who else, what person in your friend category can you name? And she found someone that would follow her wishes. Yes, ma'am.
Is it okay to name more than one person?
We recommend you name at least 2.
Okay.
And there are some people who will name 3 because they don't want to hurt a child's feelings. I have got 3 adult children, and you know, I want to put all 3 of their names down. Well, that's fine, you can do that. Even on the form we gave you, I know there's only space for 2, but you can always, in the special instructions, write a 3rd or someone else down. Yes, sir.
If, in that case, 3 children,
Mm-hmm.
does that follow the rule of majority?
Nope, it
Or
starts with
it's-
the first.
Okay.
Unless you specifically say in your special instructions, you want them to work, you really want them to agree, but, you know, you might as well not have had, made a document. Because you're still gonna have people that, you know, may not be happy. Unless you've had conversations and let them know, listen, I'll put your sister first, because she's not gonna be too emotional. She's gonna make a sound decision. You 2 are next, but this is what I want. Can you follow my instructions? Because they're just following your instructions. They don't have to make any decisions. You've made the decisions for them.
So if you, let's say you fill these out, the first person you should give it to is your family, your physician.
A copy of it needs to go to your doctor's office.
Okay, what if you've done one, and do you do a codicil if you want to update, or you just,
Start over.
okay, so they always look for the latest one?
Yes.
And then this, what would happen, the hospital would, or the physician would delete the first one?
It would be expired or withdrawn, yes,
Okay.
or both. Yes. And we've had people bring documents every hospital visit. They may have decided something every couple of years. For some reason, they come into the hospital and they have a new document. That's okay. We're gonna, you know, make sure that we have the latest and greatest that comes to the top and forward. Make sure you do not sign it until you are in front of the notary and 2 witnesses. That's very important. And the witnesses cannot be related to you. And they cannot be anyone that's already named in the document. So, once I complete, oh yes, I'm sorry.
I just had a question to ask. May 2nd, you do not need an appointment, just show up here, and Angela and her team will be here to notarize the documents. And that's in 2 weeks from today.
But you'd have to have witnesses with.
Right, but we can find witnesses on campus.
Just bring your valid ID. Just
I'll
bring
be
valid.
here.
Yeah, yeah, just bring your valid
I'm
ID.
good at signing my life away.
So you're not feeding us on the 2nd?
No, we're not.
So bring your own lunch.
No food on the 2nd. Once I complete an advance directive, I can't make changes to it or change your mind regarding your healthcare wishes and preferences, and that's false. You can, if you show up on May 2nd and you decide decide to change your document on May 3rd, you can do that. We just start the process over again. We would just complete the form, and again, we would expire, withdraw, take the old, make sure that the old one is not recognized and the new one is. So you can revoke it also. You can revoke it verbally or in writing. That's something that you can do. So we have had people who are newly legally separated. And they will call us up and ask that their document be revoked because they don't want their estranged spouse being the one to make decisions for them.
And they say
Immediately. Without having another document in place. Sometimes they're saying, I'm going to the attorney's office to get my, a new advance directive completed, even though I've shared with them, we can always send you one and get it completed, but they want to go through their attorney since they're already paying them God knows how much money already because of the divorce proceedings or the separation proceedings. So, but yeah, you can do that again verbally, or you can just send us a copy of it revoked. It's easier to do it verbally, honestly. We haven't had many people send their document with revoked written on it, so, but you can do that.
Is there a way to upload it to your portal yourself?
Yes, into your My Chart? Yes, there is. Through Novant's My Chart, there's an Advanced Care Planning tab in your menu. And so you go to Menu, Advanced Care Planning, and then there's a button where you can upload it yourself. It has to be uploaded as one complete document, not pictures of several pages. It has to be one complete document. People with smartphones and people who are able to do whatever they have to do to make it into a PDF from pictures, I call them the kids. The kids can do that today, I can't. But yeah, there is a way to do that from pictures into one PDF.
If you can get your scanner to work
Or you
correctly.
can get or scan it, yeah.
Or you can bring it to me and I'll do it for you.
There you go.
Okay.
The smart people right there.
It helps to be on the session.
Oh. All right, next slide. So I was asked to talk a little bit about the medical orders. And these are the 2 medical orders that are recognized in North Carolina. You do not have a copy of those. The reason I do not supply these documents is because of it has to be signed by a physician. I think of these forms as the old prescription pads where doctors had to, guard them with their lives because it had their DEA number and all that kind of stuff in it. And unfortunately, throughout the years, doctors' signatures haven't gotten any better. And I hate to say that there could be some bad actors out there that could just scribble scrap, and people would think it's a valid document. So anytime I present these documents, it'll either have sample on it, but you can get these documents from your provider's office. The first document, the yellow form, is called a goldenrod. That's the color of the paper that the state named it. So you'll sometimes hear goldenrod. This is just, the goldenrod only addresses CPR. If your lungs stop, if your heart stops, that you do not want to be resuscitated. It requires your doctor's signature or your practitioner's signature. And that's kind of it with that form. However, we don't like that form as much because we don't know what kind of conversation the doctor had with the patient or the patient's representatives. So that's not our favorite form, not at Novant Health. Our favorite form is the MOST form. This color is called Pulsar Pink, named by the state. It has to be original form. So this form addresses CPR in section A at the top, but it also has other decisions that you would have to make. There's also space where who was involved in this conversation with the provider. So the patient, patient's representative, healthcare power of attorney, family member. At least we know that a conversation happened around this form. Some of the other decisions are, how much treatment do you want? How much interventions do you want? Do you want full scope of treatment? Do you want a limited scope of treatment? Or do you want comfort measures? There is a place, section C, antibiotics. Do you want antibiotics or not? Section D, do you want IV fluids and tube feedings? Section E is who was involved in the conversation. Not only does the doctor have to sign it, but also the patient or the patient's representative has to sign it. So we like this form because it addresses more things that could occur. And these are the types of questions and things that you don't think about when you think about life-sustaining treatments. My father was on hospice and he had an infection. Do we give him antibiotics or not? We didn't talk about it. So would antibiotics prolong his suffering, or do the antibiotics relieve pain? What's the purpose of those antibiotics? If it's just to prolong his suffering, no. But if it's gonna help with pain or some other type of symptom that he has going on, that my father hated pain, so I do know that. so those are the types of things that we don't think about until the situation occurs. My mother, on the other hand, she didn't like needles, so she didn't want to be poked and prodded. So no, don't do anything, just leave her alone. So again, I think it helps bring up more conversations that you need to have with the people that are important to you that might have, that might be making your decisions.
And this is at the doctor's office?
Yes, you can find them at the doctor's office should have them. I had a phone call with someone the other day, and they said their doctor's office did not have them, so I called up the doctor's office. Why don't you have these? This is how you order them from the state, because these are state forms, and they have to be ordered from North Carolina Department of Human Services. Yes, sir.
We have one of those hanging in our refrigerator for my wife. When I went, the doctor said, well, he didn't have any more of the forms, I checked back later.
Yeah.
If it's only hanging on my refrigerator, who understands what needs or not needs to be done?
So.
Where else should it be?
Yeah. The legal documents, the healthcare power of attorney and the living will, we can accept copies of those. But because these are medical orders, they have to have the original in order to follow the orders. So it's great that it's hanging on the refrigerator, but if something were to happen between here and home, she would get the full scope of treatment because we don't have the original in place. So it should be with you at all times. There are some doctors who have completed multiple forms for people. One for the car, one for your purse, one for the house, one for, So I have seen that done before, but truly the original has to be presented at the time the event is occurring for it to truly be followed. We do at Novant Health scan a copy of it into your chart that can help provide some guidance, but we're gonna still ask you need to get that original here ASAP.
You talk about in your records,
Yeah.
Last week, my wife was in for a procedure, and one of the questions they asked at admitting was, do they have copies of our living will?
Right.
And the answer to that, as far as I was concerned, was no.
Right.
How do I get that to them?
So the next time you go to any provider, you can either take a copy of your document or you could take the original. And they will scan it into their chart. They will scan it into your chart, and then it can be found wherever you receive care in that system.
So if it's in my chart,
Mm-hmm.
then the answer to that question would be yes, because they do have access to it.
Exactly.
I see.
But they still probably gonna ask you that question every time.
They will still ask you that question every time you go. That is
Just like
true.
when they ask you how old you are about 40 times.
Well, Yeah, name and date of birth, can you confirm your date of birth, can you confirm, yeah.
But what you're saying is that the DNR should be carried with you.
The pink, these two, yes, these two forms should be with you at all times, if, yeah, if, especially if you want those orders followed.
That doesn't seem very right.
Well, if you're in an accident.
If you're in, yeah, and again, these are the laws of North Carolina. You'd be surprised what some of the laws are in other states, but yeah, they have to be in those. It has to be a goldenrod form, a goldenrod color, or pulsar pink. It has to be the original in order to be followed.
It seems like it's kind of impractical because it's hard to fit that in my wallet.
I definitely understand.
I don't carry a purse, so I
Yeah.
can-
Some people put it in their glove box. Again, you know, some doctors will give you multiple forms. All the decisions are the same, but we'll give you multiple forms for you to have in different places.
Something that, Lincoln County, at least they do it, I live in a retirement community down the street here. And the fire department gave us, prescription bottles, it's called a vial of life. Are you familiar with that?
I'm not.
Well, what it basically is, you get an empty medicine bottle and a sticker for your front door. It's got the snake and, you know, the shield and all that. And when they see that, they know that there's instructions in your refrigerator. And it's
Okay.
just kept in a medicine bottle.
It's not in your freezer?
No,
Huh.
it's just in the refrigerator. It's like a pill bottle, and they know that if they see it on your window, your door, then
Okay.
they need to look in the refrigerator, and you've got copies of whatever might be in
You
there,
need to have
or
in
at
there.
least instructions.
Yeah. I asked about if it was the freezer or the refrigerator, because
Yeah.
the freezer is probably the safest place for any
yeah.
document in a fire,
Yeah, oh yeah,
because the freezer is the last thing to
yeah.
burn inside the freezer,
Yes, sir,
so.
fire department, is it?
Okay, do these need to be notarized?
Those do not, they have to be signed by your doctor or provider.
Why we knew unless it was just, we got
Yes, sir.
200.
I'm kind of intimidated with this legalese, with everything, and there's so many
Departments in our
things, so many rules you have to meet. Is there what would be the simplest way to take care of what we're talking about here today without all these multiple forms and individuals and, you know, something that can get the job done? Is there an easy way to do it, or is it all gotta go with, I mean, it seems like you have to be a lawyer just to,
I'm a social worker by trade.
I
Yeah,
understand that, but
yeah.
I'm just saying, you know,
So, I think hospitals and healthcare providers, we make it probably as simple as it can get, because the forms, the advanced directives forms that we gave you is called the practical form. If you were to go onto the North Carolina Secretary of State website, you would have a healthcare power of attorney that's about 10 pages long with a lot of legalese, and a living will that's also about 10 pages long with a lot of legalese language. So what the hospital and healthcare systems in North Carolina did, along with the North Carolina Bar Institute of Medicine, they came up with this practical form to make it easy. Number one, because Medicare and Medicaid, the US government, not only do we have to ask if you have an advanced directive, but if you want more information or want to complete an advanced directive, we have to help you with that. So the practical form is the easiest form that they came up with that meets all the statutes and laws of North Carolina without all that other legal language. So if you're at the doctor's office, you get the forms there. You can also do this at the same time. If you want to make an appointment with your doctor to just do these forms, you could do that as well. You would just need to let them know what the appointment is for and make sure they have the documents in place, or they'll be calling us, which is fine. We'll make sure they have it, have what they need. But we are supposed to, by law, to try to make this as easy as quick and free. That's another thing, it's free. Everything we do is free and complimentary.
Can we have coffee?
Where? Here? Yeah, that's a time you ask me for some, do we have coffee in the
No,
house?
no. When we fill the forms out.
Oh, I don't know.
Yeah, this-
We don't usually bring coffee to those, conversations, but I guess, you know, you can, you know,
We'll take-
bring a cup.
May second, we might bring some coffee if we want to see you.
Exactly.
I have no fear.
Oh, that's it. Any questions? Oh, on your tables, we also put what we call an advanced care planning toolkit of information. This is the one that has the decision-making order, on the front page. So that way you don't have to refer back to the presentation. You have something to carry home with you and you can discuss that with your people. The second page is a conversation guide. A lot of people will say, or doctors will say, go home and have a conversation with your family. Have a conversation about what? How do we start these conversations? So this is just a list of questions to kind of start with, and kind of see where they lead. It doesn't have to all be, it shouldn't be a one and done conversation. These are ongoing conversations as your healthcare changes, or the person that you might be making decisions for, their healthcare changes. The next page is about how to choose a healthcare agent. And it also goes over some of the same things that I went through in the healthcare power of attorney document about organ donation, listing, you know, other, things that you might be concerned about. Some of the characteristics, the next page is, about a healthcare agent. They communicate well, knows you well, cares about you, will make decisions based on your wishes and not theirs. Very, very, very important, because if you select someone and you know they're gonna be very emotional, there are a lot of people who are married and don't pick their spouse because their spouse is gonna be too emotional. They're not gonna think about the other person, they're gonna be thinking about, you're not gonna leave me kind of thing. And they selected somebody else. And that's okay. Just make sure your spouse knows it. and the reasons why. And someone's who's trustworthy. The second to the last page is roles and responsibilities of your healthcare agent. So these are some of the things that your healthcare agent will be able to do and decide for you when you do not have capacity to make your own decisions. Again, this is only when you do not have the capacity to make your own decisions. And the last page is a next, I'm sorry.
Who decides whether you have that capacity?
A physician. The doctor has to decide. And remember, capacity can come and go. It's not permanent. So it's not permanent until it is. But for the most part, you know, as we continue to live our lives, it's gonna be more those procedures like colonoscopies and other things that you have to go under anesthesia for, where you're not gonna have capacity for those few days. But still, you know, I always think about it that way. And then the last page is what to do with your document. It's like a checklist, keeping the original safe, making copies, who to give copies to. It's like a checklist, because when you do revoke, if you ever have to revoke your advance directive, you'll need to make sure that you have a list of the people that you gave that one to, have them destroy it, and then you can provide them another one. So, is there anything else? And action changes things. So, some of you in this room already have your advance directive, right?
I'm not sure it's any good.
Well, yeah, exactly.
That was made out 10 years ago and everybody says it's okay, but I'm not sure.
Yeah, I'm the same way.
Yeah, your documents do not expire until you decide that it does not fit your wishes anymore. And if it doesn't fit your wishes anymore, then just complete a new one, and that will definitely expire the old one. But you should look at it. You know, the 16th that was Tuesday. Tuesday was National Healthcare Decisions Day. It's a day for everybody to kind of think about who's making decisions for you. If you have your documents in place, taking a look at them, making sure that they still reflect your wishes and preferences. Also, It's a day to encourage you to have conversations with the people that might be making decisions for you, or that you've named in your document. Again, conversations could be very short, or they can be very long, but they should be ongoing.
Will all the documents, including the yellow and the pink, work like across the country, you know, in all states? Because we specifically talked that these were a lot of things relative to North Carolina.
Yes, so there is not one state that I know of that will not accept another state's documents. We accept the documents from other states, as long as they were, completed within their laws. And so if we ever have a question, we have a legal department. They will look at an out-of-state document to make sure it met the statutory requirements of that state, and that will be okay. The pink and the yellow form, it depends. Right now, they're trying to have a national form. Right now, every state's form is similar, but it's not the same. And they have different laws. For example, in South Carolina, you can pull up their form on their, I guess it's the their emergency EMS type of a website, and you can just print it out and use it. In North Carolina, you have to have the pink form. So every state is different. Now, South Carolina will honor our pink form and our yellow form, but our state will not yet. And we definitely need a national registry, not only for the orders, the pink and the yellow form, but also for the advanced directive. And that way we could actually get a good idea of how many people and how many Americans do have these documents in place. And again, if you have any young people, 18, 20, 18, 20, 20s and 30s, they really need to have at least that healthcare power of attorney. We have families that are young people that are estranged from their families because of whatever choices that somebody has made on either end. And we really need to make sure that they understand the decision-making order, and that they have, at the age of 18, the ability and the right to decide who makes decisions for them.
How does it work to, let's say you have the do not resuscitate, and you're in your 20s, and like, you drown, but like somebody could bring you back, but you have that yellow form. How does that work in a case like that?
Well, if the form is with the person, technically, that could happen. But in that type of a situation, I don't think.
I think you try to save the person.
Yeah.
They'd have to,
Come in for paperwork.
They'd have to have.
know they had the form on them in the first
They
place.
have to have the form, yeah.
You can apologize
Yeah.
later.
And sometimes.
Yeah.
Oh, we know this now. But yeah, I think that's one of the.
Forgiveness of provision.
Yeah.
But I mean, it could have been, you went in for a colonoscopy
That's
and
true.
things didn't go right, and you had a heart attack in the middle of it.
Right.
You know, and there you are in a hospital where they probably have the yellow and the pink form.
Surgery is a whole different area and a beast to kind of deal with, because there are some people who, have had significant cardiac issues and are going in to have some surgery to fix the issue. And they may have already had the pink or the yellow form. And right now what they would do is they would suspend those orders, and they would resuscitate you, because technically you're going to be on life support anyway, because they're messing with your heart. It can't be beating while they work on it. So you're already on some sort of life support. They would not just take it off. They would try to bring it back.
That's why you need the healthcare.
Agent in place, that healthcare power of attorney. But again, usually in surgery, they suspend the form, and they would reinstate it after you're stable. So who's coming, oh, go ahead.
Down at the bottom of this page is talking about if I have appointed a healthcare agent. follow this will or follow their instructions.
Correct.
Is that new? Is that something that wasn't in there originally?
This form was created in 2014, so it's always probably been there. It may have been buried, and if you've gone to an attorney's office, it's in there.
This is way before 2014.
So, yeah.
I happened with my mother, the physician came and said, we are following her desires, but if you want it different, then we will do what you tell us. And that was very disturbing to me. I thought what she had signed so far was legally enforceable. I didn't realize anybody could change it. And this says, yes, it can be changed.
That your healthcare agent can make some decisions based on what's going on in the here and now, yes.
Right.
Mm-hmm.
So I
I'm
assume hers
thinking
did
that-
not have this in it.
Yeah, I can't tell you when if that's always been there or not.
I like the fact that it's just there.
Yeah, and
When there's no, doesn't leave them to a decision. They have to do
Right.
what you've requested.
right.
Right. Thank you.
I don't know if I answered your question, but thank you. So there is a 800 number on the bottom of each of these pages that you have. My name is Angela, and that number comes to me and Crystal. Crystal is the only one that's not here today. So if you have any questions, or if you have a friend that might need some information, feel free to give them that 800 number. Again, it comes to me and Crystal, and we'll be more than happy to assist in any way.
They own it. I don't know whether it does.
We can videotape
What?
this presentation and will be on our website, and Janine is also going to post the advanced directive and living will information on the website. Yes.
No, it is on this one.
Okay, well, thank you so much for your time and attention today. Hopefully it was some information, new information you've never heard before. And if you've already have your documents in place, your next steps are to make sure it's uploaded in your chart by either uploading it yourself through my chart or taking a copy of it to your provider's office, and they can actually do that for you, scan it in. Other than that, thank you so much for your time and attention.
Thank you.
Don't forget, May 2nd is in 2 weeks, if you want to have the documents notarized here.
And I have a few copies of the sample MOST form in this packet, if anybody wanted to take one with them. Yeah. Sure. Yeah, right. And it's on the back, the very back page.
Did you, were the cards?
Yeah, they're right here, sorry about that. Take them back for your tables, that's fine. This is the MOST form, sample copy right here for you.
Stupid, there you go. We're doing chapter 2.
You don't have to follow.
Oh.